background. So I have worked in the acute inpatient psychiatric setting all the way down to the community and home-based setting. And through those experiences, I've definitely seen, witnessed, and experienced workplace violence in the work that I've done. Everything from a patient headbutting a nurse to being part of the restraint and seclusion team to having a patient's family rip me up one side and down the other. So those 24 years have definitely given me a lot of experience and background, but it's important to extrapolate that out to all healthcare. The work that we do is hard. And we see our patients and families in really vulnerable times. And Helen went over the statistics in regards to the increase in workplace violence incidents. And, post pandemic, we feel it. We feel the incivility. We know what's going on. We know that there's stress still there. So, those are some of the reasons why workforce safety and well being are so important to me and so important to our industry. Next slide, please, Helen. So I wanted to give you just a little bit of background on the Indiana Hospital Association. So we're a member professional trade association, and we have about 170 members. And our mission statement is to provide Indiana hospitals with leadership, representation, and support to improve the health of Indiana citizens. So it doesn't say anything explicitly about the safety and well-being of our workforce. But the idea of our efforts here at IHA is that safe caregivers means better care for our patients. And that's how we can really support and improve the health of our Indiana citizens. Next slide, please. So, what did the Hospital Association do? I'll give you a little background. In 2023, the IHA Board of Directors, recognizing what was going on in our environments of healthcare, said, okay, we're going to really dedicate time, energy, resources, and funding for workplace safety and well-being. And remember, I'm a licensed mental health counselor, so I tack on that well-being every time that I can. I didn't want this to just be a workplace violence prevention program, really wanted it to be a workforce safety and well-being program. So in comes Safe and Sound. This is what we call it for short. Safe bodies and sound minds. We needed something catchy that we could kind of use and brand, so to speak. And so we have a mission statement for the Safe and Sound initiative. And that mission is to support Indiana hospitals with creating workplace environments that are both psychologically and physically safe through the provision of resources, tools, data, and training. So with that being our mission, we needed some structure, we needed some organization to help us keep the scope to where it needs to be. We don't want to scope creep. So we found the American Hospital Association's Building a Safe Workplace and Community framework. And you can see at the core of this framework is leadership. And then surrounding that leadership is education, accountability, and data. And then they use 4 pillars to stand up this work. And that is culture of safety, mitigate risk, violence intervention, and trauma support. And you'll see that this presentation is mimicking the 4 pillars. All the practical applications and resources that I'm going to go through fall into one of those pillars with leadership at the core. So one of the first steps in creating our Safe and Sound initiative was really to go down the workplace violence prevention rabbit hole. And I felt a little bit like Alice, right? There's a lot of things already in existence. So how do I mine that information, find nuggets that we can actually implement and put into a practical application? So the point wasn't to reinvent the wheel at all. We wanted to use resources that existed and help share them with our members and help our members implement those resources. So we have created, as we were mining, right, we would find little nuggets and we wanted to make sure we didn't lose sight of those nuggets. So we created a Safe and Sound Communication Toolkit, and this is a digital toolkit that lives on the Indiana Hospital Association website. You can see the link there. And the toolkit is divided into different tabs. So we have an internal resources tab, and that's for things like CEO talking points or how do you market your employee assistance programs to your workforce. We have a digital and social media tab, which is exactly what it sounds like. We have put in there easy grab and go messaging that's been vetted, and hospitals can just grab and use for their own socials. There's a resources tab. The resources tab's the largest tab in here because this is kind of a toolkit, guideline, framework, podcasts, infographics, all kinds of resources in this resources tab that don't neatly fit into one category. We have a webinars tab, the Safe and Sound Initiative. Through the course of 2023, we hosted quarterly webinars with subject matter experts. So those slide decks and recordings can be found there. And then we have a legislative tab. So Indiana passed some legislation on assault of a healthcare worker. That's cited in that tab, along with the federal SAVE Act information. So throughout 2023, we had 591 unique users visit that toolkit, which we're pretty proud of. That means it was getting some action. So for the rest of the presentation, I'm going to pull out some of the resources you'll find on that toolkit and kind of talk through how we use them, how we helped our members use them. Helen, next slide, please. All right. So remember that first pillar was culture of safety. And want to talk about the Agency for Healthcare Research and Quality, or ARC's, Workplace Safety Supplemental Item Set. It's a mouthful. So since 2008, the Hospital Association here in Indiana, we've been a vendor, or we administer the ARC Culture of Patient Safety Survey for our members as part of the service that we provide for them paying membership dues. So it's no extra charge. It's a free service, so to speak, that is part of the membership dues our members pay the Indiana Hospital Association. So in 2021, ARC created and put out this workplace safety supplemental item set. This is a survey that ARC suggested you include at the end of the Culture of Patient Safety surveys. It's an additional 22 questions survey that is divided into 6 dimensions with 4 single measure items that you can ask your workforce. So come January of 2023, after IHA vetted the workplace safety survey with a small pilot of 6 of our hospitals. We wanted to make sure our hospitals liked it, thought it was useful and easy, and they did. So in 2023, with the board support, we were strongly encouraging those hospital members that were using IHA for their culture of patient safety surveys to include the workplace safety survey item set to their culture of patient safety surveys. And I gotta say, I am so proud of the response we got from our members, because as you can see on the slide, we had 37 of the 38 Indiana hospitals that used us for their culture of patient safety survey add the workplace safety supplemental item set to their base survey. So what that means is now the Hospital Association is sitting on some beautiful aggregate information of our members. Now, the Workplace Safety Survey, ARC's national database, or their benchmark that they use for the Workplace Safety Survey, is comprised of 40 hospitals and over 11,000 respondents. Indiana, you can see we had 37 hospitals, but those 37 hospitals actually represent just over 14,000 valid survey respondents. So we did a great job at getting folks to use the survey, and now we're sitting on this gold mine of information. So let's take a look at what some of this information is telling us. So again, the 6 dimensions are protection from workplace hazards, supervisor, manager, or clinical leader support for workplace safety, moving, transferring, or lifting patients, hospital management support for workplace safety, workplace aggression policies, resources, and training, and then addressing workplace aggression from patients or visitors. Those are the 6 domains, and then there's 4 single measure item sets, which we'll talk about here shortly. But if you look at this, 2 things jumped out at me. Indiana is the dark green. The ARC national benchmark is the light green. So Indiana aggregate data, we fall a little bit under by about 5% on the percent positive response for hospital management support for workplace safety. And then the second dimension or domain that really jumps out at me is that addressing workplace aggression from patients or visitors. And that dimension includes both questions on verbal aggression and physical aggression. And you can see here that it's a 15% discrepancy, right? Now, that dimension 6, actually uses reverse worded questions. So a positive response is actually disagreeing with the statement because the statement says, on this unit, there is a problem with verbal aggression from patients and visitors, or on this unit, there is a problem with physical aggression from patients and visitors. So we can see at a composite level, Indiana had 43% of our respondents disagree with those statements, while the national benchmark had 58% disagree with those statements. So that means there's definitely something going on here in Indiana that we need to take a look at. Next slide, please, Helen. One of the single measure item questions that I referred to is this work stress burnout question. So using your own definition of burnout, please select one of the answers below. And then you can see it goes through no symptoms of burnout all the way through I feel completely burned out. Again, Indiana is the dark green and red. The national ARC benchmark is the light green and red. And taking a look at this, our 14,000 survey respondents, we're showing 38% of them have some level of burnout, whether that's the beginning to burnout, symptoms that aren't that won't go away, or completely burned out. And the national benchmark is at 31%. The other thing I want to say about this question, because I know burnout can be a little bit of a soft topic, so to speak, not scientifically hard. This question actually comes from a research and evidence-based and vetted survey called the Mini-Z Burnout Survey. And this question is pulled from their emotional exhaustion domain. So it is scientifically backed, saying that the results you get from this question are really going to show an accurate picture of the state of burnout. So we've got some work to do in Indiana based off the idea that we used our culture of safety surveys to include the workplace safety supplemental questions. So that's a practical application. Add the workplace safety supplemental questions to your culture of safety surveys. Next slide, please, Helen. So what do we do with this information? And we wanted to be data informed, and we wanted to start with the pillar of culture of safety. Now, one of the other pillars from that framework from the American Hospital Association was trauma support. So RISE, or Resilience in Stressful Events, is a peer support program that hospitals can stand up within their organizations so that they can provide their workforce support after an adverse event. Johns Hopkins is actually the creator of the RISE training because they experienced a traumatic event of a pediatric death on their unit. And they realized that they weren't giving their workforce, those folks that were involved in this event, a lot of support after it occurred. And there was a large ripple effect from this event. Now, remember my licensed mental health counselor background. I have actually experienced firsthand a RISE response for myself in my unit when I worked direct care. And so I looked at the data, right, the workplace safety data, and then applied also some lived experience and said, okay, this might be something that we can bring to our members. The other thought about bringing RISE in is that it's an organizational approach to trauma support. It's not saying, hey, person who is affected by an event, here's our EAP, call them if you need them. It's much more, hey, we know something happened and we're going to go ahead and provide support without you needing to help seek. It's one of the things I really, really liked about this program. So, how did we get this done? Again, back to leadership at the core. We had to approach our board, explain what it was, explain why we want to bring it to our members, and we were able to get their commitment and appropriated funds for the training. It's this idea again of embedded peer support teams to combat the effects of workplace violence. And again, events can be anything from death of a patient to a medication error, to a violent act within your facility. So there's no set definition of what an adverse event is. It can be many, many things. So the Hospital Association has regional patient safety coalitions. We also have councils. So we went on a recruitment mission and we ended up with 13 hospitals saying, hey, we'll commit to participating in the RISE training and standing up peer response programs in our organizations. So what did we have to do to get this done? We absolutely had to contract with the Maryland Patient Safety Center. They are the trainers and owners of the RISE curricula that Johns Hopkins created and developed. We had to schedule, right? It's 2 days of virtual training. Day one is a leadership training. Day two is the peer responder training. So it's a bit of a heavy lift. It takes some time and effort. So from the 13 hospitals that agreed to go through this training, that actually represents 13,701 FTEs that could potentially be covered with a RISE opportunity for trauma support in the response of an adverse event. So there's some pearls of wisdom I definitely want to share around this. What worked is that leadership being part of the first day of training was a necessity. Nothing beats firsthand experience through the training. And we were able to really engage leadership and get their buy-in from that first day of training. What was difficult, if you think about it, the Hospital Association has 170 members, and we were able to have 13 commit. I think there's room for improvement there. I also know that with healthcare, there is all kinds of balls in the air with competing priorities. I also know it's a little bit difficult to commit to something that you're not 100% understanding what it is. So my hope is that the 13 organizations that went through this training, we can do some case studies or case examples to share with what our other members at large. And one of the things that surprised me about implementing RISE is the organizational fears that these hospitals had around confidentiality and reporting. There was a lot of discussion about what peer response is and what it isn't. So, right, it isn't counseling, it isn't therapy, but yet it's a peer support, active listening ear. So we really had to talk about some of those organizational fears. It's going well. And because it's going well, we are thinking about a sustainability plan. We want to continue RISE training, but we want to add a little adaptation to include asynchronous modalities of learning, not getting rid of the two live virtual training days, but just kind of enhancing with some asynchronous training also. Those folks that have been trained as peer responders within those 13 hospitals, we are convening on a quarterly basis for a community of practice of peer responders. If we really want this to continue, we really want to make sure those peer responders are taking care of themselves, are practicing their skills, are learning new resources, and are recruiting more people to continue to build the peer responder pool. We're definitely going to provide and research resources that support the infrastructure of peer response programs. And we want to host subject matter experts for continued learning and skill building. So that's one practical application of trauma support that we committed to as a result of both experience and both data. Next slide, please, Helen. Still in this trauma support pillar, because we recognize that RISE is a heavy organizational lift, we wanted to look at another resource that's a lot easier, lot lower effort. So there's something called Notice, Talk, Act at Work. It is a 35-minute online course. It is for people leaders. It's not an all staff training. It's for those that manage others. And it's created by the American Psychiatric Association Foundation. So I, again, mining for resources, happenstance found this and said, I wonder what this is like. So I reached out to them and said, hey, could we do this course for a small pilot of folks just to see if we like it? So went to the board. They said, okay, you can do a small pilot. We'll fund pretty nominal fee, pretty small fee. And the idea here is that it helps build that hospital management support for workplace safety and well-being. Remember that domain in the workplace safety survey? This is something that could really perhaps impact those scores, since that's where we were 5% under the national benchmark. So we were able to recruit 39 individuals that represent 19 different member organizations, and they all took the course and they all completed an evaluation after that. And this meant we had to contract with the APA Foundation. They created electronic links that were sent to individuals. And the results were that out of the 39 individuals that took the course, there was an overall rating for Notice, Talk, Act at Work of 4.36 out of 5 stars, so to speak. I'm going to read you just a couple of comments that were made in the evaluations because it helped us determine what the Hospital Association was going to do in the future. So one of the comments said, this is a good module with very helpful tips on how to. I feel we see a lot of managers that are not comfortable with conflict, and conflicts in quotes. So with all the information given, they may continue to struggle with the applicability part of addressing difficult situations. And this training helped with that. Another comment was, I feel this would be beneficial to provide this training to directors and managers within our hospital system. So because of that overall response that we got, we contacted the American Psychiatric Association. We said, hey, we'd like to offer this to our membership at large. What do you think? And they said, you know what? If you have 170 members, we're going to go ahead and offer a flat discount for you off of the training. And we're like, thank you. Appreciate that very much. The other thing about the training that helps with sustainability is because it's online, it's easily integrated into our members' electronic learning platforms. So there's an ease of distribution to your managers and leaders and supervisors that may want to take the course. So those are two examples of some practical application tools in the trauma support pillar. Helen, can we go to the next slide? Thank you. So remember, there's the mitigating risk pillar. And I know that public awareness signage is a very popular strategy to look at. So I wanted to address that in this webinar and kind of show you what we did at the Hospital Association. So we knew we wanted to do something around signage. We loved the idea of all of our members using the same lingo and the same branding or visual graphics, so it has a feel for a statewide approach. So with the board support to pull this together, we pulled in a graphic designer. We also pulled together, and this was probably the most important piece to this, we pulled together a focus group to provide feedback on the graphic designer's drafts, so to speak. So we had security, we had risk and management, We had HR represented, we had someone from labor and delivery, we had chief nursing officers. So we had a range of folks sitting at the table, looking at the language and looking at the graphics. Once we settled upon our message, which is violence in the hospitals not accepted, safe caregivers means better care, let's keep our hospitals safe. We had to contract with the print shop. We knew that our IHA website did not have the capacity to distribute and order these banners because the board said, hey, we will provide funding for one large retractable pop-up banner per organization. So we found a print shop that was actually also able to stand up a web store. And so we were able to get electronic codes to our members, and they were able to go onto this web store platform and order their free banner. And out of our 170 members, we had 87 members order one of those banners. So we thought that was a pretty good return on investment. What worked is really this across organization approach. It gives a nice statewide consistent message. What was difficult, oddly enough, was the co-branding on a dark background is harder than you think. I am not a marketing person, and this was interesting. So you can see on the bottom of the image, there's an IHA logo, and then the hospitals were able to add their logo in, and it was a little bit of a challenge. Some of our hospitals don't have like a marketing or PR department. So you were talking with someone who did some other job in addition to doing some, PR and marketing. And what surprised me was really how our members preferred and appreciated a serious look and message and tone. It's a fine line of balancing, hey, this is a healing environment and be kind to our staff, to the other end of the spectrum, which is, we will not stand for violence, we're not going to put up with this kind of thing. So it was an interesting dance to come up with this. And I appreciate Lindsay because that was going to be one of the things that is in the future state is we did not have patients or families as part of this focus group. And if I'm going to do it again, we're going to include those folks. And we actually are looking to do it again. We want to adapt the imagery to include more diversity. We want to create a second banner that is not hospital specific. So perhaps, violence in healthcare is not accepted. We want to reopen our web store. We're not going to be able to offer a free promotion, but we want our folks, our members, to have access to these banners. And we want to include posters also. So your 8.5 by 11s, your 11 by 17s, along with because these are large scale retractable banners that you can put up in your lobbies or emergency departments. So that's the process we went through in regards to the mitigating risk pillar. And yes, I would highly recommend bringing in families and patients to include their thoughts on this. Our first go around was really in supporting of the workforce and what kind of message they wanted to give. Next slide, please, Helen. Still under mitigating risk, there is this concept of codes of conduct. So IHA has 7 councils in which our members all over the state contribute their expertise and their insight to tackle these kinds of issues and topics within healthcare. So we have the Council on Behavioral Health, Council on Finance, Council on Government Relations, Council on Information Management, Council on Quality and Safety, Council on Rural Health, and Council on Workforce. So the Safe and Sound initiative, we pretty much dog and pony showed the idea of codes of conduct around to 4 of those 7 councils. We wanted to get a sense from our members if this is something they even wanted to pursue, if we thought, if they thought that they would put this into their patient rights and responsibilities or their policies and practices. So the idea here is that we created principles, right? And the 4 principles are promotion of a safe and respectful environment, communication of behavioral expectations, communication of potential consequences for behavioral violations, and the direction of patients, visitors, and staff to support the code of conducts. So the idea here is that we have statewide principles that each member can adapt and tweak and adjust to fit their particular organization. We knew a blanket code of conduct itself wasn't going to work, but we were wondering if code of conduct principles were going to work. So on October of 2023, after we drafted a couple of drafts of this and walked them around to our councils and our coalitions, it was decided upon and approved by the board, one of our drafts, that we could use this as principles across our membership. So before we did our drafts, I continued down the rabbit hole and I found an example from Mass General Brigham and the Massachusetts Hospital Association. And that is the example we leaned on heaviest. It's not exactly the same as theirs, but it's similar in type. So that's what we started out with. So again, not reinventing the wheel. Engaged our councils, engaged our members. One of the things that we had to do as part of this process is run this by our Deputy General Counsel and our Communications VP for review. And they definitely had edits and language that they wanted to make sure was appropriate. So once the board approved in October of 2023, our president here at Indiana Hospital Association sent out personally to all member CEOs a communication about these principles and how, when taken together, they may have an impact on our workforce safety and well-being. One of the things that worked, again, was this idea of a cross-organization approach with a statewide consistent message. I will tell you what was the most difficult is that words matter, right? Writing language that instructs patients and visitors what to do versus what not to do was the tack that we took. So for example, instead of saying, do not bring firearms into the hospital, the language suggests you say, keep your firearms in your vehicle, right? And using that kind of language is telling people what we expect them to do versus what we don't want them to do. The other part of that was using plain language. If the idea here is we're giving this information to our patients and visitors, perhaps in the rights and responsibilities, we want to make sure it is digestible and understandable. And so using plain language was really, really important to us. So some next steps about this is, what good is a code of conduct principles if you don't use them and they get dusty in a binder somewhere on a shelf, right? So we really want to create not only an IHA communication campaigns, we want to create a video that speaks to our members about, hey, remember we have these code of conduct principles. We really want a call to action to use these in your policies and practices. But then also we want our members to communicate their code of conducts, not only to their patients and visitors, but to their workforce, so that the workforce can understand what the expectations are of our patients and visitors, and help hold people accountable to those codes of conduct. So we are going to ask our members for some examples of how they adapted these principles to meet their organizational needs and policies, and then share those adaptations with the membership at large. Next slide, please. So the other pillar that we haven't addressed yet in the AHA framework is violence intervention. And I wanted to give a practical application on this because violence intervention is really about partnerships. It's really about knowing the resources that your organizations have or don't have, and where can you find them if you don't have them. So IAHSS is the International Association for Healthcare Security and Safety. They are a national membership organization. They have over 3,000 members, but every state has a chapter. So I was able to find and come across the Indiana chapter contact information. And I went down the rabbit hole of their website and was looking at what all they could offer. And some of the things that I think are going to be helpful for our members, that where we don't have to reinvent the wheel, is that IAHSS have created guidelines, industry guidelines for what safety and security look like in your organizations. They have a document about what to look for when you're hiring security in healthcare. So they have some really, really good resources to share on their website. The other thing that I think a partnership can really assist with is this idea of legislative efforts. So in 2023, with Indiana's House Enrolled Act 1021, which was protections of healthcare workers in the emergency department from assault, that was a combined effort. IHA and IAHSS, that is so hard to say, really stood together and said, this is what we really think legislation needs to say. Now, there's room for improvement in that legislation, so that's going to be a future effort. But it's also leveraging the expertise of this organization and sharing with each other and getting in front of each other's audiences and members. So, how did we build this partnership? It really truly started with a cold call, a cold email um, from me to the Indiana chapter of IHSS. I'm just going to read it to you really quickly. I pulled it up because sometimes you just don't know what can come from these blind emails. So I had to start with, "Hi, Anthony," or is it Tony? Because I didn't know this person and what they went by. I said, "My name is Lori Gert, and I work for the Indiana Hospital Association. I'm doing some work and research on healthcare workplace safety and well-being for our members. The International Association for Healthcare Security and Safety has come across my email a few times now, and I looked up the Indiana chapter information with your name and email were there. Thus, this email." So you can see that's just where it started. What's going to be occurring now, next steps, is we are formalizing our relationship and we're going to have a memorandum of understanding between IAHSS and IHA so we can support each other in our efforts. So, for example, IAHSS has a crime study that they conduct every year. And so I pushed that crime study out to our participants and our members and said, hey, consider putting in your data and contributing your data for this study. The IAHSS will have a presence at our Patient Safety Summit. So again, creating partnerships to help violence intervention is part of this process because we cannot do it alone. And I highly recommend everyone reach out to your own state chapter of IAHSS. Again, helpful people with great resources. Next slide, please, Helen. So this is a broad practical application. This is not pillar specific, but I wanted to share it because there are so many resources. Sometimes our members just don't know where to start. So we decided to create a workforce safety and well-being menu. So consider this idea a fixed menu of an appetizer, main course, and dessert, where you can add on a bunch of different side options. So in looking through all the resources, looking at all the nuggets that we bind, and saying, hey, if you're one of our members, where do you start? We decided that we would pick the appetizer of the Workplace Safety Supplemental Survey. We're telling our members, if you want to start somewhere, let's start with some of your data. And then you can move on to the main course of using a workplace safety gap analysis or safety assessment. And as you can see here, there's 2 links, 2 examples. Ashram has one, the state of Minnesota has one. So using some sort of checklist and seeing where you are doing things in workplace safety and well-being and where you might be missing some elements. And then topping it off with dessert with really looking at your policies and seeing where you can include those code of conduct principles. And then we have a bunch of side options, right? So you can involve yourself in the Hospitals Against Violence National Awareness Day coming up June 7th. You can decide to use the Violence in the Hospitals Not Acceptable posters. You can pursue the Mental Health America Bell Seal for employee workplace mental health. It's an application and a small fee, but it's a great way of looking at what do you offer your workforce in the world of mental health and support. You could add on the Culture Patient Safety Survey. So I just wanted to give this an example because it's hard sometimes with so many resources to know what to use and where to start. So we decided to make a menu for our members for it. Next slide, please, Helen. Another broad application example, going back to our webinars that we offered quarterly in 2023, we made sure that each of the webinars, subject matter webinars that we offered fell into one of the pillars. So our first webinar was bringing in Laura Castellanos from the American Hospital Association, and she walked through the Hospitals Against Violence framework. Our second webinar was bringing in IAHSS, and they presented on hospital security and police departments. Under violence intervention, we brought our friends in from Michigan Medicine. They have a very robust security department and program, and they trained on situational awareness. And then we did bring in the Maryland Patient Safety Center to talk to our members at large about the RISE peer response teams. So again, all of this is to build a culture of nonviolence, of psychological safety, of physical safety within the Indiana healthcare workplace, making sure that all activities fell into one of those buckets so that we really kept our focus. We really didn't scope creep. And it's been a really, really fun year. And I'm so pleased that IHA has committed to continuing the Safe and Sound initiative within 2024. So those are some examples. Love to take some questions, Helen, if there are any out there.
Thank you so much, Lori. That was incredible. Such practical information, knowledge gained from your the work that you've been doing at the IHA. I'd like to open it up to questions. Anything, you pop it in the chat. You're welcome to unmute yourself. I've changed that setting, but any questions today for Lori? Group today.
Okay, then I have a question for them.
Oh, yeah.
If they could just answer in the chat. I'm just curious how many folks use the workplace safety survey. Just a yes or no is fine. I'm just trying to get a beat because truly that was one of the drivers of our activities.
Question.
So kind of a healthy mix.
A bit of a yes and no. And did you submit their ARC survey to their database? No.
So we are in process of submitting. So ARC has, their time frame of when we submit data. So we have not submitted data yet because the time frame is coming up in June. We will, with the data user agreements from our members signed by ARC. So we have two different levels of data user agreements. One, we have a data user agreement for our members to use IHA as their ARC Culture Patient Safety Survey vendor. That's one. And then there's a separate data user agreement between our members and ARC themselves to submit that data. Not every single one of our members submits or signs that DUA to submit data to ARC. The other thing that we are looking at doing is Indiana Hospital Association, is taking our workplace safety aggregate data live using a data visualization tool through Tableau for those members that actually did the survey to see how they compare to their peers that took the survey. That's not live yet, but that is something that we are working on.
Lori, there's a question here from Patrice Mayo. She says, a super impressive body of resources and support you're providing in Indiana. Is there a feeling yet that by hospitals and their environments are improved and safer? How are patients and families responding to the banners?
I don't have a good sense yet that environments are improved or safer, and I don't think we will. I do think culture and safety work is gonna take a couple of years. We are fully hoping that we can continue to survey and look at the workplace safety survey aggregate results year after year after year and see if we see any domains or areas where those surveys look like they're improving. But right now, no, we do not have an impression. Um, do not know how patients and families are responding to the banners. I do know that the workforce appreciates banners. We do a lot of site visits where we get on site with our members and we'll see, where the posters are up or there's a banner in the lobby and we'll ask, okay, what do people think about this? And the people that usually say they really appreciate it is the workforce, those folks working in those facilities. I do not have feedback yet on how they're being received by patients and families, but I'm going to add that question.
All right, Patrice, this is inspiring work. Questions for Lori? Well, we're just so impressed. You've done absolutely, as Patrice is mentioning, so much work using all of these publicly available resources. So to be able to find things that any hospital listening today, any hospital across the country can tap into, and they can, do the exact same type of work that you're doing at the local level.
I definitely feel like one of Snow White's dwarves. I mean, it is going through a lot of information.
Emily James says, we appreciated the banner and I believe our hospital safety culture has changed for the better. Oh, so Emily must be one of your member hospitals. I very much appreciate the work Lori has done at IHA and will continue to do. Absolutely. Oh, they had an active shooter event last July. Oh, things have changed
Thanks,
for the better.
Emily. I'm really good, really glad to hear that.
Great. Well, I just want to thank you so much, Lori. That was incredible. Oh, Kim has a question. What kinds of resources or information will be most helpful for our team at Convergence to provide throughout future sessions in this series?
Yeah, Lori, thank you so much for sharing. I think this was a great foundational set for everyone. So here's kind of an overview of everything that's available through IHA. That's, you guys are so generous in sharing all the resources that you have. And wondering then from folks that are on the line, is there anything that's, when you think about a workforce series, any burning topics that you want to make sure that we cover, knowing that we have a pretty broad group coming and lots of expertise in addition to Lori's wonderful expertise today. And you can type it into the chat.
So folks are thinking and typing. I'm going to remind us of our session next week. We'll be hearing from Libby Hoy and Lindsay Galley, creating healing environments, more than a message. And so we look forward to next week's session. Huge thank you to Lori. Lori, thank you so much for sharing your work with us today and for kicking off this series. We're very excited to move forward with this. And please follow up with me. There's my email address. If you have questions for Lori, happy to send them over to her. Or as Kim was looking for information on that would be most helpful for our team to provide throughout future sessions, just send me an email. We'll be more than happy to hear from you. And thank you very much for everybody for attending today. We will see you next week for our second session and have a wonderful rest of your day. Thank you very much, everybody.